So this is an information call about the UCL Partners and NHS Improvement Culture and Leadership Collaborative. And it's just an opportunity for anyone who's interested in taking part in the collaborative to find out a little bit more about the programme. So I'm just going to click through my slide. Bear with me a second. So the programme team involved in the collaborative are Dr. Sonia Warbank, who is on the line today.
Hello.
Sue Burgeon, Michael Watson, who's also joined us today from NHS Improvement, and then from UCL Partners we have Kate Hall and myself, Rachel Peniston. So on the call, we're just going to be talking through what the Culture and Leadership Collaborative is, what we're trying to achieve with it, and what we think trusts who are taking part can get out of it. Michael will take us through the collaborative content and the programme and what it will involve for those taking part. And then there's an opportunity for anybody on the line to ask any questions. So to provide a little bit of background, the Culture and Leadership Programme was developed by NHS Improvement and the King's Fund in 2016, and since then they've been providing trusts with online resources and support from NHS Improvement colleagues for those trusts who want to explore developing a more an inclusive leadership and culture for their organisations. UCL Partners approached the quality and leadership team at NHS Improvement to explore how we can make the most of this opportunity in this region. And we're looking to work with 6 trusts to go through the programme with the added support of an IHI Breakthrough Series collaborative model, which Sonia will talk a little bit more about in a moment. In terms of who should take part, we're looking for any NHS trust who's looking to further their efforts in creating a culture. You could be at any stage, you could be just starting to think about it, you could be beginning your journey, you could be a little bit away along. This is about providing kind of structure and support and a bit of a peer network as well. You'll be learning from other organisations who are taking part. And obviously I'm not going to go through this list, but this is the UCL Partners region, so any questions about whether you're in the region or not, I'm very happy to answer, but hopefully you'll be able to see your names on here. So I'm going to hand over presenting to Sonia now, who will take us through what the Leadership Collaborative is.
Thanks, Rachel. So we've chosen a Breakthrough Series collaborative model because we know that we've got evidence-based success for this model when it's working across areas of complexity. So large numbers of teams from the same hospital or clinics who are seeking improvement across a particular topic area. We know that the opportunity to work on common challenges speeds up that learning and means that we're both learning from each other, but also learning as the programme progresses. So it speeds up that learning process for us, but also means that we're not engaged in wasted efforts. So the team that are coming in terms of NHS Improvement have had lots of experience of the culture programme itself being adopted, but actually having people together in a room who are all going through this journey at similar times, we think is a really interesting way of testing out, is this model supportive for people? Michael's going to share the background and the phases in more detail, but just to say that what the collaborative is looking to do is to support you through your phase 1 programme discovery. So this is where you're going to be using your different measures to work out where you currently sit in terms of collaborative leadership, and then help you with an interesting design and strategy around, so what are we going to do? What are our priority areas? The collaborative will close as you begin to implement your projects, and then we want to come back to you a year later to see how you're getting on. So the support is there in terms of getting you to that project management stage of implementing the projects that you want to be working on. So we have designed a programme with relevant content. So we know the things that you may need to know in order to attempt large-scale culture change. But what we also wanted to do is have a model that was agile enough to respect the fact that there's going to be different organisations with different challenges, so ensure that the content was iterative and able to respond to the needs of those individual organisations. So we're going to offer you direct teaching experience. So we've got lots of people who are waiting to come and share their learning in terms of leadership, culture change, action learning, so we've got a specific way of learning from each other as we're going through it, but also expert and experienced speakers. I'll talk to you about the faculty in a moment, in terms of how do you get the best out of the change team that you're going to be working with in your organisation, and how do we help you adopt and spread this model as quickly and sustainable as we can. So this is an adaptation of the theory that we're really testing here. So we know that the culture programme, working through the culture programme, is a really supportive way of achieving culture change. But what we want to design is a programme that starts off by us sharing the kind of expert knowledge that we know, and then over time developing those relationships with you, so that by the end of the programme, actually you're teaching us, you're sharing the learning with us in terms of what's worked for you, and then how can we take and adopt those ideas to be sharing across it. Just in terms of dates, we're looking roughly at about 18 months worth of support through the programme. Face-to-face learning sessions, 8 of those that we're setting up bi-monthly, webinars and coaching sessions directly with you and the team in the midst of that, and then participation in a joint evaluation so that we've got that learning recorded and able to share. So I'm now going to hand you over to Michael, who's going to talk you through the specifics of the programme. Sorry, I preempted myself. Sorry, I didn't tell you about the faculty. So a big important one. So our faculty, we have already secured Michael West to come and talk to us, open the programme and be there as our advisor throughout this work. Simon Mackenzie, who is our medical advisor here at NHSI, will be supporting us in terms of medical input. Susie Bailey from the King's Fund and Aidan Fowler, who's our Director of Patient Safety again at NHSI, will be joining us. And then we have Sally Brown, who is nursing and patient safety advocate, and Katie Stewart, who's doing a lot of work on the culture programme at the moment across trusts, again to support and advise us. And so initially the faculty will come together to help us design the programme and then help us with what we need to change and adapt as we understand what organisations need, but also on call if we need specific help and support around the project works that are going on. I promise you it's Michael now.
Thank you, Sonia. Good morning, everyone. As already mentioned, my name is Michael Watson. I lead on the operational support that we currently provide to organisations through the culture programme within our culture team. I've been working on the programme since just shortly after we launched our first set of guidance back in 2016, and have seen it grow from that time really as being support that we were working with 3 pilot trusts to develop the tools, which I'll talk about in a moment, to helping nearly 50 providers through the programme as we speak. And I think that this collaborative offers a really interesting addition to the ways that providers can do the programme. So I hope you will consider whether it's right for you. So I'm just going to run through what the programme is and where it came from, and I'm not going to go into the kind of background to it in too much depth, other than to flag something called Developing People Improving Care, which is the national framework for action on leadership and improvement across the health and care system. And that actually is a collection of 13 national organisations who have come together to try and create 5 conditions that evidence shows us are vital to having a cross-system culture of continuous improvement in care for people, population health and value for money. And the second of those conditions is compassionate, inclusive and effective leaders at all levels. So this programme very much fits within that national strategic framework. And in addition, the regulators, including NHS Improvement, recognise our role in enabling organisations to be able to develop those kind of cultures, and the importance of us modelling compassionate and inclusive behaviours in all of the work that we do. And we're trying to live up to that, and that's a big driver for the NHSI and NHSE coming together that's taking place at the moment. So that's the kind of the policy framework. In terms of the importance of the programme itself, so our programme is entirely evidence-based. The majority of that evidence coming from the work of Professor Michael West, including this study which shows that if you have a 5% of more of your staff working in real teams compared to pseudo teams, which are teams that are teams in name but not in function, that's associated with a 3.3% drop in mortality rate, which for the average acute provider represents around 40 deaths per year. And then a study published towards the end of last year shows that a 1 standard deviation increase in overall staff engagement can lead to a nearly 1% drop in agency spend as a result of a reduction in sickness and absence. And again, for the average trust, that's a saving of around 1.7 million. And we also know that that same 1 standard deviation increase in staff engagement also leads to a drop in staff turnover of 0.6%, which obviously contributes to resolving one of the real issues that are facing provider organisations at the moment. So our core argument with this programme is that culture and leadership isn't a separate issue from the operational challenges that are facing organisations in the health and care system at the moment, but actually is a key part of helping to overcome some of those challenges. And this slide, which I won't go into more detail, just sets out some of the other areas where the evidence shows that increases in team working shows benefits, in particular around effectiveness and innovation, reduced error rates, etc. So in terms of what the Culture and Leadership Programme does, it looks at the 5 cultural elements that Michael West has identified as being vital to creating a culture of compassionate, inclusive and collective leadership. And those 5 elements are vision and values, which is a constant commitment to quality of care. It's goals and performance, which is about having effective, efficient, high quality performance. Support and compassion, which is about that support, compassion and inclusion for all patients and staff. Learning and innovation, so that continuous learning and improvement approach. And then finally, teamwork, which is about enthusiastic cooperation, teamworking and support within and across organisations. And in terms of the theory and evidence that I've just discussed, there's a document online at the NHS Improvement pages which goes into much more detail on the evidence base for the programme and also some of Michael West's theories that underpin that. But all of our programme is designed to help organisations improve the way they're performing in relation to those 5 cultural elements. And this slide really just shows you how those elements are underpinned by 10 leadership behaviours, which I won't go through, but again, they're the leadership behaviours that Michael West has identified as having to be present in order for those elements to be achieved. But the 2 things that I would highlight on this slide is the top bar running across the top, the levels. So our programme is designed to look at leadership, culture and leadership at all levels, so individual, team, inter-team, organisation, and then cross-organisation. And then the second, the bar at the bottom, which focuses on one of the crucial elements of being able to create a culture of compassionate and inclusive leadership, which is around workforce capacity. So the numbers of your workforce, the diversity in demographics, and then the knowledge, skills, and abilities within it. And both those things are addressed, both in terms of the levels and the workforce capacity are addressed by the programme, with the idea that if you have those 5 elements and leadership behaviours and the right workforce capacity, etc., you're able to achieve 3 outcomes, which are around quality and value, continuous improvement, and healthy, flourishing, and engaged staff. And in terms of how we suggest that's done, Sonia was talking a little while ago about phase 1 and phase 2. So we've created a programme which is effectively split into 3 phases. The first phase, which is the discover phase or the diagnostic phase, in which we look at use the 6 diagnostic tools that we've created in partnership with provider organisations to look at your existing cultural leadership, again, through the lens of those 5 cultural elements. Then the phase 2 stage, where you look at the typically 5 or 6 areas that the diagnostics have shown you need to look into further, but it could be more, it could be less, and use our resources to design a strategy or an approach to tackling those or improving in those areas. And then finally, the implementation phase, the deliver phase, which is where you actually deliver those interventions. So in terms of phase 1 and the tools, we have 6 tools that I mentioned, and they're a mixture of quantitative and qualitative data and information that then form your overall picture of your organisation's performance. There are 2 quantitative tools, which are the Culture and Outcomes Dashboard, which uses your staff survey data, existing staff survey data, through questions that Michael West has identified as being the ones that can map over to the 5 cultural elements that I mentioned. So it's just a different way of looking at the data you've already got. You also include some CTC data and some financial performance data in that dashboard as well. So for the first time, you're starting to look at your cultural performance against various areas of your organisational performance. And that's a dashboard that NHS Improvement can provide for you very quickly with the click of a button, because as I said, it uses the staff survey data that's publicly available. And then the patient experience tool, which essentially does a very similar thing, but using your friends and family test data to try to map across your current experience of patients against those 5 cultural elements. And then there's a board interview process, which, as the name suggests, is effectively interviewing your board's approach to support and to determine their approach to supporting effective organisational culture within your organisation and their views on present culture and where it's going. And then a leadership behaviour survey, which is about getting an understanding of your staff and stakeholder views on behaviours of your organisation, staff and leaders as a whole. So against those 10 leadership behaviours that I mentioned earlier. And the important thing to say about that is that what you get at the end of it is a view of your staff, is a sense of your staff's view of the leadership's performance against those 10 leadership behaviours, but also their own performance against those behaviours. So you get an understanding of your own staff's capabilities and capacities in relation to leadership. And then we suggest that you run a series of focus groups to delve into some of the issues that may have come out of the behaviour survey in more detail, so you can get a bit more narrative experience from your staff about how their views of culture and how it works at the moment. And then finally, leadership workforce analysis, which is effectively looking at your current workforce and your future needs. And again, going back to that bottom bar in the slide I mentioned a few slides ago around current skills and diversity, etc. And when you've got all of those, we've done all of those 6 tools, you go into the synthesis stage, which is where you bring them together to get an understanding of the areas that you need to focus on. The thing that I would mention about the program as I'm describing it is that we're describing it in a very linear way. So you do the diagnostic, then you do the development of your strategy, and then you do the delivery. The reality is that we've learned from working with trusts that it's not that linear. And in fact, as soon as you start to introduce the program into your organisation, you're effectively making a culture and leadership intervention. We're just starting to talk about culture in a different way and making changes as you go. The big thing that I think makes our program different from others that are out there is the fact that we suggest very strongly that actually this work is delivered by a change team. So a change team would be multidisciplinary from across your organisation, clinical and non-clinical, all different levels, and that change team would actually drive through the program in your organisation, including, as we suggest, carrying out some of the diagnostics. And the best example of that would be the board interviews. So most of the organisations we've worked with have used their change team to actually interview the board, and that means you can end up with some relatively junior members of staff going to interview board members about their views on culture. And the anecdotal feedback we've had from those board members is that they, through that process, also learn a lot about how culture works in their organisation. So I'm going to skip through to our recommendations on that, but I would just say that once you've done your phase 1, you then go into phase 2, and we have available a compendium of, I think it's around 70 interventions that have worked elsewhere with case studies, etc., that we, in our general support offer, would support trusts through, but which in terms of the collaborative, I know you'll get a lot of help from the faculty, etc., to work out what would work for you. And I mentioned just in terms of our recommendations, so the things that we've discovered are really important from working with trusts is that you don't have to use all 6 set of diagnostic resources because you may have already done diagnostic work in your organisation, but actually you need some form of data to replace them. So if you're not going to do the focus groups, it would be helpful if there is some narrative information, for example, that you have from your staff through other focus group or engagement activities. The program works best if it goes across a whole organisation because it is designed to give you a strategic lens and approach to your culture work, but that we're not prescriptive at all. So the program is designed to be adapted to local organisational needs. The other thing that I would just mention that's not on that slide is just around the need for board buy-in to this process, and in particular to have an executive sponsor to help drive that through. And we've learned that that's really crucial. So in terms of trusts using the program, we're now in actually, since this slide was produced, we're now nearly towards 50 trusts that are using the program, with a number that have expressed further interest. Well over a third of those trusts are in what we call category 3 or 4 of our single oversight framework, which effectively means requires improvement, rated requires improvement by the CQC, or in special measures, financial or quality. So we're working with trusts in all kinds of circumstances. And I just want to very quickly run through these final slides, which are actually from some of the trusts that are using the program. So this one, which I won't go into in detail, but we'll just have a look at another time, is just around how the program links to the well-led key lines of inquiry. So the program is deliberately designed to help improve performance against those key lines of inquiries. And in fact, when the second iteration of the well-led framework was being produced, it took the cultural leadership program into account when it was devising what the CQC would be looking at when it's assessing an organisation for well-led. And that